Benvindo a comunidade She Ultra. Hiya, I'm Esyllt. I'm a GP and I'm one of the medics on the She Ultra. Welcome to the She Ultra community where we always promote healthy lifestyle, healthy minds, healthy bodies, and we're so passionate about health promotion and health intervention. So on that theme, I'm going today to take you through a really easy, quick self-examination of the breast. And I'm going to do that with the aid of this model, which has been so kindly donated by She Ultra to the Oncology Centre in Faro. So for this examination, there's two parts. There's look and there's feel. What I do with the look is that I always stand in front of the mirror, shoulders straight, hands on the hips. Basically, what you're looking for with this is for any unevenness, any differences between both breasts. And it's important for you to know that there can be differences between the breasts, and differences are normal. What we need to be aware of is what's normal for you. So if there's a change from your normal, then that's when you need to have it checked out. So you're standing in front of the mirror, hands on your hips, shoulders straight, and you're looking for any changes in size, shape, symmetry, any thinning or changes of the skin maybe. And you always need to look down to the nipple area. Any changes there, any discharge, any crustiness. Is the nipple going in or both nipples going in possibly? And again, do they look different to you from what they did look before? So again, getting used to what it looks for you. After you've looked in this position, I would then put both hands behind my head, and by doing this you're tensing the pectoral muscles and you're comparing both sides to the other. When tensing the pectoral muscles, you're possibly then showing lumps and bumps that are not as obvious when you've got your hands in the other position on the hips, okay? And that's all done. That's the look part of the examination done and dusted. For the feel, you need to be quite relaxed. You probably need to, what I tend to advise is that you're lying maybe on your bed with your head propped on a pillow and then you've got your hand behind your head again, okay? But I'm going to use the model because it just makes it so much easier to show you easier how's the best systematic way of examining your breast. I tend to use 3 fingers to palpate. If you use 2 fingers, sometimes you feel something that's just the normal structure and support of the breast. So by using 3 fingers, then you can actually get a better idea of how it should be feeling. Again, don't panic at all if you do feel something that's a bit different. Maybe something that's a bit grainy, like a marble size, a pea size, or even a walnut size, okay? They can all be quite normal, but do get it checked out. So with the 3 fingers, I move systematically down from the collarbone area here, and I move around the breast. By doing this in a circular motion, quite firmly, and you do need to press quite firmly, and you need to press and do what's comfortable for you. And I move inwards, making sure that I'm overlapping all the areas, moving inward like that, into the nipple area. And that gives you a chance once again to check on that area. Is there any changes there? Is there any crustiness? Is there a discharge? Is the nipple going in? Okay? And then before I finish, I move outwards into the armpit area. Because in that area, if there's any abnormalities, any inflammation, any cysts or anything in the breast itself, you can have some swelling in the armpit. Again, don't panic if you find it, but if you do please get it checked out. That's what we're here for, okay? And of course, you then go through exactly the same thing with the other breast. And by doing it like this, you don't miss anything. Breast examination, really, really easy. Look, feel, systematic. You won't miss anything. Know how your breasts feel. Know what your normal is. And if you're not sure, get somebody else to help you and help check it out, okay? And try do it at the same time in your cycle, because breasts can feel differently depending where you are in your cycle, if you're on the pill, in the perimenopause. So again, check it at the time when's convenient for you, but make sure that you remember when you've done it, and try maybe just put an alarm on your phone, something as simple as that, okay? Works for most of us. So that's all done. Please, please, please make sure that you do this, okay? It's so easy, it's so quick, and it absolutely does save lives. Diolch, obrigada.